My name is Tomasz Guzik, and I'm editor-in-chief of Cardiovascular Research, and I have an honor to host today one of the deputy editors of our journal, Professor Charalambos Antoniades from the University of Oxford. And we are meeting because during the European Cardiac Society conference this year, he had an opportunity to present a unique study showing a novel modality for imaging of inflammation in coronary arteries. And I think it's particularly interesting from the point of view of translation of science, because in a relatively short time you have actually made the whole journey from describing the basic mechanisms of the observation to verifying it in large clinical populations. Can you tell us a little bit more about that journey?
Yeah, first of all, thank you, Tom, for inviting me to be here in this interview today. Actually, it wasn't a short journey. It was a very, very long journey. It took more than 10 years.
For translation, you know, 10 years is
yes.
quick.
So the journey started when, about a decade ago, we were trying to understand how perivascular fat communicates with the vascular wall. And the idea was that fat secretes various molecules that exert a paracrine effect on the vascular wall, and they affect atherosclerosis. However, when we used a more translational approach, when you used biopsies from patients and we tried to see how the biology of the fat correlates with the biology of the actual vessel on which it is attached, the results we were getting were exactly the opposite to what we were expecting. So we're finding consistently, for example, that when you have increased oxidative stress in the vessels, in the human arteries, then you have increased expression of adiponectin, which is essentially antioxidant in the perivascular fat. And all the data we had from humans were pointing towards the direction that it's the vessel that drives the biology of the fat, and the fat responds to stimuli coming from the vessel. And this is how the journey started. And over a decade, we realized that essentially when you have inflammation in the vessels send the signals to the fat surrounding them. The cells in the fat surrounding the vessels sense the signals, and they change. And since we had the biology, we then asked the question, can we identify, can we visualize these changes in the biology of the tissue, of the fat tissue surrounding the vessels? And because if we can, then we can visualize inflammation in the vessels. And this is how we got into the CT imaging of perivascular adipose tissue. So the new technology essentially visualizes the three-dimensional changes of the attenuation of the perivascular adipose tissue. And these changes reflect the inflammatory burden of the actual vessel on which the perivascular fat is attached. And by using this new technology, we are now able, and this is what we presented in the ESC meeting with a simultaneous release in the Lancet, we are able to predict fatal heart attacks 5 to 10 years before they happen. This new biomarker, the fat attenuation index, essentially started from a basic science observation, and it was moved into prospective clinical studies, and this is where we are now.
And I think that's why it's so interesting from the point of view of cardiovascular research in general. Can basic science still help you to develop this technology further, and what aspects do you foresee?
Yes, so the biomarker that we are talking about, that is the fat attenuation index, is not a typical biomarker like a CRP or any biochemical biomarker. This is an evolving imaging biomarker. So the way we define it today is not the way we defined it a few months ago, and it will not be the way we define it in the next few months. Simply because the more data we get into our databases, we use artificial intelligence and we use machine learnings, and we modify this and we adjust it for more and more different factors in order to optimize and improve its predictive value for different aspects of cardiovascular disease. So essentially, it's a new generation of clever biomarkers that change over time when you feed more data into your development tools.
I think it also changes our view of typical basic science, because, you know, with basic science we always think of pipette, and more often it's actually a keyboard. Thank you very much for joining us today, and we are really going to look with very great interest, and considering that you are working with us for the journal, with pride for the development of this story. Thank you, Harris.
You're welcome.